There's a common question that comes up nowadays amongst physicians and even patients, and it has to do with artificial intelligence. And the question really is, can AI uh, be better than your doctor, or at least find things that your doctor could have missed? The answer is sometimes yes. But that does not mean that AI is better than your doctor. The more accurate way of thinking about it, in my opinion, is by saying, AI is another set of eyes or a second opinion built in. And in medicine, second opinions are priceless. So let's think about cancer. My good friend, who's a radiologist, he looks at CAT scans, MRIs, chest X-rays all day long, and he looks at thousands of individual images, and he's looking for subtle abnormalities, tiny lung nodules, abnormal lymph nodes, a mass in the breast, um, and he's gone to medical school and studied anatomy, and then he's done radiology for many, many years to ultimately get to this point. And AI systems can be trained on an enormous number of medical images, and they learn mathematical patterns associated with cancer and other abnormalities. So when AI evaluates a new image, it can highlight areas that deserve additional attention. And there's definitely evidence that this can make a difference. Breast cancer screening studies have shown that artificial intelligence can identify some cancers that were retrospectively visible on earlier mammograms but were not picked up at the time the test was done. And in some studies, AI detected meaningful proportion of so-called interval cancers, cancers diagnosed between routine screening exams that could be seen or suspected on previous mammograms. That does not mean the radiologist was incompetent. Uh, some cancers are extremely subtle, and really it's like looking for one unusual tree in an enormous forest. All may recognize a pattern differently when you're thinking at AI from a human eye, but uh, we're combining human eye, my experience, and an AI. I think it'll definitely be worthwhile. So we jump from radiology, meaning looking at pictures, to pathology. We are using microscopes, and instead of a pathologist looking through a traditional microscope, uh, now AI can help a pathologist do a digital image of millions or billions of pixels. And therefore, artificial intelligence is going to analyze those images for pattern associated with cancer cells, and tumor architecture, and that can pick up a lot of information a lot faster, a lot quicker, and at a expedited manner. The National Cancer Institute is actively studying AI-based digital pathology and combination of radiology and pathology to improve cancer diagnosis and prognosis, and ultimately treatment selection. We're now using artificial intelligence in cardiology for our electrocardiograms, cardiac imaging, uh, ophthalmology. Eye doctors are looking at the diabetic retinal disease by AI usage. In neurology now, we are looking at brain images, identifying strokes by using AI, and increasingly Even in the laboratory, the results are looked at by using AI, and we're getting much better results. So, the FDA already maintains a large list of AI enabled medical devices which are authorized to use in the United States, with medical imaging representing a major portion of the field. So, should we simply let AI diagnose everybody and Dr. Alex Eson goes home and is useless? Absolutely not, because AI can also be wrong. AI can also be have false negatives, and that means it may tell us something that looks normal, but it actually isn't, or it tells us something is abnormal that it actually is normal. So, in a nutshell, AI may identify something as suspicious, and there's actually nothing dangerous there. And that could cause a lot of anxiety, additional scans, and unnecessary biopsies. But it also could definitely pick up on things that a radiologist or a pathologist could have missed. So, using a dedicated FDA authorized AI system to evaluate mammograms, uh, I think, is a very different uh, scope to consider, rather than just saying, I just want to have a chatbot address my problems, or I don't believe in artificial intelligence because I want to see Dr. Eson. Uh, the reality of the matter is that day by day, artificial intelligence is assisting us in being uh, better doctors. I personally have begun using artificial intelligence more in my own clinic, yet it doesn't replace physical exam, it doesn't replace almost 25 years of experience, but we can combine human judgment with artificial intelligence to miss fewer cancer diagnoses, diagnose disease earlier, and ultimately save more lives. That's where technology becomes exciting, in my opinion. Anyhow, my goal, as always, is to help you understand not only how medicine is changing, but also what science actually tells us. And if artificial intelligence scares you, don't let it. It's our friend. You're still going to have us, and we're going to work together and take care of you. Have a lovely